Guys, today we'll talk about classes of antiarrhythmic drugs. So first let's start. What is arrhythmia? Arrhythmia is a problem with the rate or rhythm of the heartbeat. It means that the heartbeat is too quickly or too slowly or with an irregular pattern. If it's too quickly, it's called tachycardia. If it's too slowly, it's called bradycardia or irregular. So, what are the classes of antiarrhythmic drugs? We have class 1, 2, 3, 4, 5. What is class 1? Class 1 is sodium channel blockers. Class 2 is beta blockers. Class 3, potassium channel blockers. Class 4, calcium channel blockers. And finally, class 5, miscellaneous. So let's see the heart rate diagram as we see here. P, Q, R, S, T. This area is called PR intervals. This is QRS. And then ST interval, ST segment, and QT interval. The P wave in ECG indicates for atrial depolarization. The QRS responsible for ventricular depolarization, and the T wave is the ventricular repolarization. We have 0, 1, 2, 3, 4 phases. So let's see what will happen of the classes of antiarrhythmic drugs to the heart rate. First of all, we have class 1. Class 1 is sodium channel blockers. We have 1A, 1B, 1C. 1A is a moderate, which is called quinidine and procainamide. 1B is weak, as lidocaine and phenytoin. 1C is strong, as flecainide and propafenone. Class 1 drugs bind to and block the fast sodium channels that are responsible for the rapid depolarization, phase 0 of fast response cardiac action potentials. Then, class 2, beta blockers, propranolol and metoprolol, which they act by blocking effect of catecholamines at the beta-1 adrenergic receptors, thereby decreasing sympathetic activity of the heart, which reduces intracellular CAMP and hence reduces calcium influx. These agents are particularly useful in the treatment of supraventricular tachycardias. Class 3, potassium channel blockers, as amiodarone, sotalol. Potassium channel blockers act as prolonged cardiac action potentials, resulting in an increase in the effective refractory period, with the exception of ibutylyl, which shows outward sodium current during repolarization. Class 3 drug block potassium channels. Then class 4 calcium channel blockers, as verapamil and diltiazem. They decrease conduction through AV node and shorten phase 2, the plateau. It's called plateau of the cardiac action potential. They thus reduce the contractility of the heart, so it may be inappropriate in heart failure. Finally, we have class 5 as adenosine digoxin as cardiac glycosides. Adenosine is used in the treatment of paroxysmal supraventricular tachycardia. It decreases conduction along with the AV node and prevents the movement of free entry circuits into the heart. Thank you so much for watching my video. Please don't forget to subscribe, share, and like my video. See you soon. Bye.